is titled Resident and Family Focused Care in an LTC Home. I'm very excited to be joined with our presenter to introduce to you Manju Joseph. Is a highly accomplished director of nursing services with 14 years of experience in long-term care. She holds a Bachelor of Science in Nursing and is certified in gerontology nursing, showcasing her extensive experience in the healthcare sector. To further strengthen her leadership, Manju has obtained a certificate in Director of Care and Leadership in Long-Term Care, which empowers her to effectively guide and evaluate her team's performance in delivery of exceptional care. Through her collaboration and proactive approach, she has enhanced residents' care, streamlined operational efficiency into a culture of compassion and excellence in the long-term care setting. Manju is also a key player in the RNAO's Best Practice Spotlight organization, where she actively champions the integration of evidence-based practices into clinical environments to advance residents' care. Thank you, Manju, for joining us. And we are also joined with Teresa Hohang, is the Director of Clinical Services at Wellesley Central Place for over 2.5 years. She is a recent graduate of the Silver ADOC Certificate Program and a graduate of the Toronto Metropolitan University RN program. She previously worked as a registered nurse in the intensive care unit at North York General Hospital before transitioning into long-term care. In addition to her formal education, Teresa brings a wealth of leadership experience from her previous roles with the City of Toronto. Before becoming a registered nurse, Teresa worked as a personal support worker, providing direct care to residents, and also gained valuable experience as a clinical extern at both St. Mike's Hospital and Humber River Hospital, assisting with patients with their activities of daily living. Teresa's diverse background in healthcare spans multiple environments, including various health clinics, North York General Hospital, and HCP Diagnostics. Teresa is dedicated to ensuring that residents receive the highest quality of care through continuous improvement and collaboration with team efforts. She is actively involved in the RNAO's Best Practice Spotlight organization and working to integrate evidence-based practices into clinical setting to further enhance patient care. It is such a privilege to have you both with us today, with your backgrounds and your experience in the way that you've been leading your organization through your BPSO journey. And I'm very excited to hand it over to you for us to go through your presentation. Thank you.
Thank you for that wonderful introduction. Okay. There you go. There you go. So I'm going to start off with the land acknowledgement of Rakai Centers. So we acknowledge that the land on which Rakai Centers the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. This land is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. We honor the resilience, strength, and contributions of the First Nation, Métis, Inuit communities, and we are committed to building a more inclusive and equitable future. As we strive to foster an environment that embraces equity, diversity, inclusion, and anti-racism, we acknowledge the importance of understanding and addressing colonization's historical and ongoing impacts. Our commitment to these values is reflected in our everyday practices, ensuring that all community members, residents, families, and staff are treated with respect and dignity. We pledge to continuously educate ourselves, listen to the voices of Indigenous peoples, and take meaningful action toward reconciliation and justice. In gratitude and solidarity, we stand together to honor the past, acknowledge the present, and work towards a better future for all. So I am going to start with our objectives.
Thank you, Teresa. Our objectives for this webinar is define our context and guiding principles, describe our approach and how we are working to meet our goals, and effectiveness of our resident and family-focused care. Background. The Regai Centers stand out as a long-term care homes that have been handpicked to partner with RNAO for the BPSO designation since 2023. Our facilities are located in downtown Toronto, providing resident-centered care to 240 residents in our 2 homes. We are committed to enhancing our practices, prioritizing resident safety, and adhering to exceptional quality standards. We take great pride in our remarkable team spirit, collaborative culture, and unyielding willingness to embrace change. The Regai Centers has 2 homes. One is Wellesley Center Place. It has 150 residents and 160 staff members. Our unique characteristics are Rainbow Wing for 2 LGBTQI plus community, and 4 is emotion-based care dementia unit, which name as BScN Nest, which the name was picked by the resident and the family members of that unit. The second home is Sherborne Place. It has 90 residents and 130 staff members. Their unique characteristics are they have peritoneal dialysis, and also they are relocating to brand new Cherry site.
Thank you, Manju. So I will be reading our vision, mission, and values and how that incorporates with the patient and family-centered care. So our vision is dynamic, transformative leadership, supporting a campus of care. Our mission is to provide integrated, reimagined care for seniors in our community. And our values are excellence with heart, inclusion, innovation, collaboration, accountability, and empowerment. So just looking at our overall vision, mission, and values, some of the PFCC themes incorporated are establishing a therapeutic relationship, where that be providing care to residents, working with family members, having visitors in our home. As well, we have care wrapped around the individual. We want to know the whole person, as well as communicate, collaborate, and engage with the residents, as well as the family. So our overall goal is to improve residents' quality of life by participating in the Registered Nurses Association of Ontario's, otherwise known as the RNAO, Best Practice Spotlight Organization, so BPSO designation. We hope to improve staff knowledge and proficiency, implement RNAO best practice guidelines, also known as BPGs, for care delivery, and develop sustainable measures for quality improvement.
Thank you, Teresa. This is our champions pictures. We have almost 30 plus BPSO champions in both homes, and they are really working hard to achieve our goal.
Your message will be saved for 3 days.
Only.
I have no more messages.
This picture shows our BPSO champion celebration, which happened on September 2024. It was a successful event, and our CEO, Sue Graham Nutter, gave a wonderful speech, which was inspired by the staff and the BPSO champions, and it's really helped us to improve our BPSO journey.
So here I have a picture of our 3 BPGs that we had selected, part of our best practice spotlight organization journey. So the first year was preventing falls and reducing injury. The second year was person and family centered care. And our third and current year is working on the assessment and management of pain. So on our next slide here is our BPG implementation of our person and family centered care. I just wanted to share the rationale for selecting this BPG. So in addition to being an RNAO requirement, this BPG was selected due to our active family council and strong family presence advocacy. We aim to support family members and residents who actively participate in their own care by giving them evidence-based knowledge, decision-making, and resulting in the best care outcomes. Here we have a picture board of our BPG that is accessible and visible on the main floor of our home. Guys, sorry, the internet cut out for a second. Is everything okay now?
Yes.
Okay. So sorry, back to the slide here. As you can see, we have a picture board of our sorry, let's try that again. As you can see, this is our PFCC picture board that is accessible and visible on the main floor at our LTC home. It is something that all staff, family members, visitors, and residents can see as one of our BPG implementation.
This is a
Next slide, please.
If you just click in the middle of your screen, you'll get control again.
There you go. Sorry about that.
Sorry about that. Thank you, Teresa. This is our person and family-centered care journey. Our gap analysis was done on January 18, 2024. Actually, a gap analysis is a process comparing your organization's current practice with evidence-based best practice recommendations to determine existing practices and processes that are currently implemented and supported by best practices. This information is useful to reinforce practice strengths. Recommendations that are currently partially implemented in practice. These would be good first targets for change efforts. Recommendations that are not currently being met, and recommendations that are not applicable to your practice setting. As I mentioned, that gap analysis was done January 18, 2024, and we engaged the team, the internal and external stakeholders as needed in gathering information for the gap analysis. There are 8 practice recommendations are met and 6 partially met. Our celebrate the recommendations that are met and prioritize the areas that we want to work on and action plan. The action plans are personalized care planning to be done by all departments, which identify the specific needs of each resident to ensure residents are valued as people, not just their conditions and diagnoses, to facilitate stronger bonds between residents and the healthcare team. Examples are reminding staff to wear badges, new badges for private caregivers, reminders to introduce oneself and explain procedure, updating care plans to make them more personal and family-centered care, including use of resident name, life stories in the room, and role they play in PFCC. The second action plan was implementing care conference feedback questions, which help residents and benefits of engaging with healthcare team to increase resident and family confidence in the healthcare team and to promote resident and family engagement and satisfaction in care. The third one is making family and resident satisfaction surveys available to complete upon every staff interaction, which ensure we are consistently providing exceptional care to let residents and families know we are about their opinions and to correct any concerns in a timely manner. Then next one is initiating life enrichment hurdles for new admissions. Life enrichment staff will provide units with personalized resident introductions so staff become familiar with the resident background to better understand a resident from the first day in our home. And also it helps staff navigate difficult situations more confidently and to promote understanding.
Thank you, Manju, for sharing our action plan. So I will share some of the challenges that we have faced. The first being time constraints. So our staff at the home, from all departments, we often face time pressures, but the reminder to be intentional about family and especially residents' interactions and visits. It's mentioned during huddles, meetings, and rounds every day, just to have that reminder of we really want to focus and how we can incorporate person and family-centered care in everything that we do. So the second one is communication barriers. So clear and effective communication is essential in PFCC, but there are certain challenges such as language barriers, there's health literacy issues, as well as differing communication styles can complicate this process. Our main goal is to ensure that all parties understand the information that is provided in different ways and that their needs can be expressed every single day whenever staff are interacting with them. And then the two other challenges that are mentioned are resource limitations as well as resistance to change. While these challenges exist, overcoming them can lead, and it does lead to more personalized, compassionate, and effective planning and health for the residents, improving both patient outcomes and overall satisfaction.
The outcomes of our patient and family-centered care journey so far is to promote evidence-based practices to help members of this interdisciplinary team become more adept at practicing person and family-centered care, to improve individuals' experience of and satisfaction with the care and services provided within the REGI centers, and to foster empowering relationships with residents and their families in order to optimize their health and wellness. Our sustainability plans are ongoing staff training and education. Before I start there, I just want to explain about the sustainability plans for person and family-centered care. We are focused on creating long-term systems that maintain high-quality patient and family inclusive practices while ensuring the ongoing availability of resources and continuous improvements in care. Below are several key strategies to ensure PFCC sustainability. Staff training and education, which helps us to continuous professional development, will focus on communication, cultural competency, and understanding the principles of PFCC. This includes ensuring that all healthcare staff, from physicians to administrative personnel, understand the importance of involving families and residents in the care process. The second plan is integration of PFCC into organizational culture. We have incorporated PFCC values into the mission, vision, and strategic goals of the organization, as Teresa had mentioned earlier. When leadership embraces PFCC at the highest level, it sets the tone for the entire institution. The third plan is community and stakeholder engagement. We aim to strengthen relationships with community organizations and support networks. Collaboration with community stakeholders such as local advocacy groups, social services, and non-profits can extend the reach of PFCC practices beyond healthcare settings and into the community, ensuring families have access to the resources they need. The last one is resource allocation. Allocate specific resources for roles focused on patient and family support, such as our resident and family service coordinator. Our RFSC, resident and family service coordinator, serves as vital points of contact to facilitate communication, ensure that families are included in care decisions, and through transition in care.
Thank you for sharing our plans, Manju, and then we do have just some times for questions for the audience.
Thank you so much for sharing your experience and your achievements. There's so much that we can learn from your organization's approach to resident and family-focused care in the LTC home. Wonderful presentation, really walking through your journey and all the amazing things that you're doing there for your residents, the organizations and the families that you serve. At this time, we would like to take some questions from the audience. If you have a question for our presenters, please type them in the chat box. And we'll be sure to direct your questions. I can see that there might be one right here. Oh, lots of questions coming in. Wonderful presentation. Yes, Hannah Cruz is telling Teresa Manju just how much she enjoyed your presentation. Thank you, Hannah, for that. And Anne Marie is asking, how have your residents and families responded to the changes that you've made? It's a great question, Anne Marie. We'll hand it over to you, ladies.
All right, I can take that question. Thank you, Anne Marie, for that. So I would say at the beginning, I think like myself, there is a bit of resistance to change. However, one thing that was really important was sharing the rationale behind these changes, right? Like sharing the RNO best practices. These are evidence-based guidelines to really promote the end goal of better resident outcomes and healthcare. So at the beginning, there was a bit of, why are these surveys? There's quite like these questions that we're answering. What is the point of it? So being able to spend time and explain the processes to our residents as well as families. Overall, I would say they have been very accepting and glad of these changes because at the end of the day, like Manju and myself doing rounds on the floor, seeing that the changes have really seeped through from the staff to all staff on the units. So that way the residents' healthcare is the one that's affected in a positive.
And also, I just want to add one more thing. Families really appreciate this initiative because they get a chance to part of their loved one's care. That make a big difference in their perspective of care too.
That's wonderful. Thank you. Thank you for that. And Amanda is asking, what is the staff to resident ratio in your home?
In terms of PSW, our ratio is that 1 PSW for 6 residents for day shift and evening shift. And for night shift is 2 PSW for 25 residents. In terms of RPN, 1 RPN for 25 residents. And in terms of RN, 1 RN for 50 residents.
Okay, thank you. And Heather's asking if you could speak to the timeline of the implementation of the family-centered care BPG, including the design and the survey collection, etc.
It's a journey, as all you know, aware that, because we started with the gap analysis, which really gives us the place where we are, during that gap analysis. That really help us to see that how we can improve, and, the action plans also help us to guide to achieve more. It's a continuous journey. There is no stop. But, it's after the gap analysis, we see that where we are. And then we can go from
there. Okay.
And then just to add to Manju's gap analysis, and I know Heather, you mentioned it sounded like you chose 1 year to focus on the BPG, and in one of the slides earlier I had mentioned our 3 BPGs, the first one being fall, the second one being PFCC, and the third and most current one is being pain. So once like Manju said, it's not just 1 year and that was it. It was doing the gap analysis, being reasonable with the timeline, so the action plan, assigning certain people in leadership in management, as well as utilizing the BPSO champions on how we can implement certain implementations that were met or partially met, and it's continuous because we are still doing like all the gap analysis from the pain. We are still doing to this day, as well, again with PFCC, and then again with pain being the most recent one.
And also, I want to add that, it's like after the gap analysis, we see that, okay, these are our action plans. Sometimes it works, sometimes it doesn't. Then, we have to revisit and see that why it was not working and what are the other action plan we can take to be part of this PFCC to continue. There is no this one is right or this one is wrong, such things like that. we have to try it, and if it's not success, try the other one, different one. That's how we are doing.
That's wonderful. Well, that helps just kind of direct us into this next question is how do you measure the effectiveness of the person in family-centered care?
We do in different ways. We have the resident satisfaction survey. We have the family satisfaction survey, which we review in a weekly basis. We are analyzing in a monthly basis. That's we are practicing. And the other method is that we are auditing the documents. Like if the staff are doing the things, for example, multidisciplinary care conference, during that time we are asking the family member about the staff care and all over the things, and they're giving us that feedback, and that's also help us. And also as a part of resident and family centered care program, we implemented personalized care plan. That's the staff and Teresa and I, we are looking that if that the staff are following those things. This auditing help us to see that where we are. These are the main things, which we are looking for the effectiveness of this BFCC.
Yes. Wow. That's amazing. There's one more question here and it's asking how can we effectively engage family members in the care planning process to ensure that both the residents and family needs are taken into account? That's a great question. How would you respond to that?
For that question, I can say that because family, definitely we inform the family. In our Wellesley Center place, actually, we have very much family involvement. They are involving all types of care for the resident. That's why it's not that much hard for us to involve the family to be part of this PFCC. I know that some other homes less family involvement, that really gives them the challenges to participate the family members. As far as like Wellesley, we don't have that issue. And if the family is not participating, we are encouraging them to, participating. In our weekly email to the family members, we always mention about this BPSO and reminding them about the family surveys and the resident surveys, and which I think these are the things which help us to, involve the families and residents.
Oh, wow. Absolutely. That's wonderful. I don't see any other questions in the chat. Oh, let's see here. No, I don't see any at this time. And that was a lot of great questions and incredible discussion and lots of comments on just how amazing the presentation was and how informative it was. And really, your journey helps provide that knowledge for others as they are either starting their journey or in the midst of it. And so that's very exciting. Oh, we have another question. How would this have been seen from a program coordinator's position? Let's see.
Yeah, this is like actually this is not only nursing department initiative, it's as a whole. All the departments are involved. This person and family centered care. In our opinion, the life enrichment, the program, they also have a big role to play to provide the person and family centered care. And we are working very close with our program team to achieve these goals.
This is the same with like dietary and environmental as well, like doing the gap analysis, putting in attainable goals on our action plan that's incorporating. I know like we're both director of nursing, director of clinical, but I do want to share that a lot of this, and for even the resident and family service coordinator, there's a lot of involvement from all aspects and all people from leadership and management.
Oh, that's wonderful. Great. Well, we've had such a great discussion today, and As we prepare to wrap up today's webinar, I would like to thank everyone for taking the time out of your day to take part in this webinar, and a very special thank you to our presenters on a very engaging webinar and informative. For those of you who are participating in this live webinar, you will soon receive a link to an online survey to evaluate today's presentation. After you have done this evaluation, you will receive your certificate of attendance. In addition, please let us know of any suggested topics you would like to see. Please know that this work is funded by the Government of Ontario. And again, thank you so much for joining us today, and do enjoy the rest of your day. Thank you.
Thank you so much for this opportunity.
Oh, thank you very much.